We're back with Dr. Nodarse. Doctor, what are the steps that a parent can take if they suspect their child has ADHD?
I think that the first thing really to do is to talk to the teacher. Teachers are ones of the first to diagnose ADHD because they're able to contrast your child with the behavior of the rest of the children in the class. And ADHD symptoms really stand out. Really, they're very classical. So to really begin to talk to the teacher. And then the second step would really be to get an evaluation with mental health professionals in child psychiatry so that if whatever doubts you have can thus be cleared up.
Okay, what kind of a specific training or education does a doctor need to treat children with ADHD?
Well, basically doctors that are psychiatrists such as myself, you know, we've gone through college, medical school, then we've done 4 years of adult psychiatry training and then 2 more years of child psychiatry training in specific accredited programs. So we end up with degrees from all these places and then years again of clinical expertise.
Once the child has been diagnosed with ADHD, how do we go about the medication and the treatment? Is it more effective combining meds and behavioral therapy, or is it more effective doing one alone?
You know what happens that there are some, you know, the presentation of ADHD varies so often. There are some kids that are really mild, others moderate, others severe. With the mild kids, you may just be able to do psychotherapy by itself, and that would be wonderful. There's no need for anything else. Then with the more moderate to severe, you may need to give psychotherapy and some medications. And with the very severe, you may need to give medications, give individual therapy, plus add psychoeducation and groups. So we really titrate based upon, you know, the clinical presentation, but also each kid has its own personality. So we also have to look at that. How is this kid's personality?
What's your take on alternative medicine?
I think that alternative medicine has a place in the treatment of ADHD. For example, we do incorporate relaxation therapy into our treatments at the Child Study Center. We also incorporate creative arts therapy as well as yoga classes and a few other things. However, we are mostly mainstream and we follow the guidelines of the Academy of Child and Adolescent Psychiatry. So things that are iffy we're not going to try on children until they have been clarified via studies.
What kind of things can a parent do at home to help ADHD children?
I think that one of the most important things is to really help set a behavioral chart so that there are consequences and that you, the parent and the teacher, talk continuously so that between both of you, you have a behavioral chart that resonates, the one with the school with the one at home. And then the kid understands that the home and the school is a continuous process, that if you mess up here, you're going to mess up over there. Doing that, I think it's really helpful for the kids. Also with ADHD kids, you want to have rooms in your house which are very clean and uncluttered. You know, kids need a lot of physical signs, like put this here and remove this. So as long as you can be very concrete with providing directions to these kids, this really helps them a great deal.
Okay. And finally, Dr. Nodarse, what do you consider the key components for successful long-term management of the challenges of ADHD? You
know, I really think that treating ADHD is treating, it really takes a village, and that village is composed of, you know, the child psychiatrist, the psychologist, the psychotherapist, the social worker, the school teacher, the principal, and certainly the parents at the center of all of that. Because, again, it is a difficult illness to treat because of its chronicity. You need all those people involved on an ongoing basis, year after year, as the kid goes from 5th to 6th to 7th to 8th grade, so that the gains that he made at 1 year continue to resonate throughout his academic career, and therefore he can have a brighter future. So ADHD does not necessarily need to be this terrible handicap, on the contrary.
When is the right time to tell your child they're ADHD?
You know, I really think that it depends upon your child's level of maturity. Some 7-year-olds can tackle it well, and yet some 14-year-olds may not tackle it well. I think, again, as in all child psychiatry, you have to titrate that to the personality of the child.
Dr. Narsa, I want to thank you so much for your time, and also the Child Study Center. We need more people like you to educate the community and help us out, with this illnesses affecting our children. Thank you so much.
Thank you for inviting me to your program.
We're going to go on break, and when we come back, we're coming back with Miguel Perez.